Let's talk about a really interesting and timely subject that you may very well hear on the news this week. Can weight loss medications help you drink less alcohol? Perhaps you've noticed something really interesting. Many people taking GLP-1 medications like semaglutide or tirzepatide aren't just eating less. They're also saying, I simply don't feel like having that glass of wine anymore, or that cocktail, or that beer. For a while, doctors thought this was just anecdotal, but now the science is catching up. Recent clinical studies have shown that people taking GLP-1 medications experienced fewer alcohol cravings, fewer heavy drinking days, and in some studies drank substantially less alcohol than those taking placebo. So what's happening? Well, the apparent answer is in the brain, not necessarily in the stomach. GLP-1 medications don't just reduce hunger, they also influence the brain's reward system, the same dopamine pathways involved in cravings for food, alcohol, nicotine, and other addictive behaviors. So it has a lot of implications. Instead of constantly thinking, I want another drink, many people describe something remarkable. The desire just isn't there anymore. Researchers often call this a reduction in reward driven behavior. It's almost as if the medications turn down the volume of our cravings. One randomized clinical study found meaningful reductions in alcohol craving and heavy drinking, and another study combined a GLP-1 medication with cognitive behavioral therapy and showed even greater reductions in heavy drinking among people with alcohol use disorders and obesity. So, even more exciting, if you think about it, research now suggests that these medications might also help people struggling with nicotine, opioid, and other substance abuse disorders. Amazing. So, the potential is enormous, but it's also important to remember something at this point. At this point, these medications are not yet approved specifically for treating alcohol use disorder, and larger clinical studies are still underway. Now, as physicians, we've always thought of GLP-1 medications as treatment for diabetes and obesity, but now we're beginning to appreciate that they may also change the way the brain experiences cravings. This may ultimately become one of the most important discoveries about these remarkable medications. I'm Dr. Raymond Singer. I hope this was helpful, and I'll see you next time.